This evening, a Cuban nurse shares her experience treating COVID-19 patients in the intensive care unit at the University Hospital of the West Indies. Now, Nurse Maria Rivera says she is one of over 300 Cuban nurses in Jamaica helping to fight the pandemic. Shamela Pullen reports.
Meet Maria Rivera. Nurse Rivera is a registered nurse from Cuba who specializes in critical care. With Jamaica short of critical care nurses, Nurse Rivera and over 300 other Cuban nurses were sent here to help.
We came here in 2017, so we didn't come with the COVID pandemic. We came as a government cooperation program that Jamaica has with Cuba. So right now there is over 300 Cubans all over Jamaica, but it was before like 200. So it's a government program in which we cooperate. The group that is here, we were 28, and we came in 2017, February. We were supposed to go home last year, but that's when the pandemic struck and we were asked to stay and assist Jamaica with the situation.
Nurse Rivera has been working in the intensive care unit, ICU, at the University Hospital of the West Indies, UHWI, attending to COVID-19 patients who are severely ill. She says each day her hands are full, caring for COVID-19 patients who are unable to help themselves. She says most of the COVID-19 patients seen in the ICU are suffering from underlying medical conditions such as respiratory issues, diabetes and obesity. She says those conditions with COVID-19 have worsened their situation.
ICU is always trying, and in this case the patients require most of the time to be intubated, sedated, paralyzed, so it's very hard to interact with the patient and give them hope to keep fighting and so on. And also we have to give them all their needs. We have to do most of the things for them because they are critically ill.
She says at least 40% of the patients seen in the COVID ICU end up dying.
I think it's always difficult when you are caring for the patient for a period of time and you are doing everything that is possible. The doctors, the nurses, the physiotherapists, everybody is doing the best that is possible. They are here, let's say 15, 20 days. And when they pass, it's really hard because we have been all working and with the hope of making them get out of the place and they pass.
Shamela Pullen, TVJ News.